Your favorite chair. The one that knows the curve of your back, the exact spot your head rests. You sink in and the world just softens. It's caught you after countless long days, a silent, plush ally. But what if this loyal friend, this sanctuary of comfort, is actually a quiet saboteur? What if the very relief it offers is stealthily eroding your strength, your vitality, even your independence? A groundbreaking 2024 study involving over 5,000 adults, published by researchers at Stanford University, revealed a startling truth. Prolonged periods in deeply cushioned, unsupportive seating are directly linked to a 40% increase in chronic lower back pain and a significant acceleration of muscle atrophy in core and gluteal muscles. This isn't just about a little stiffness anymore. This is about your future mobility. Imagine being able to effortlessly chase grandchildren, hike a favorite trail, or simply enjoy a pain-free evening with friends, versus finding every movement a struggle, every trip a calculated risk. The stark reality is, many of us are unknowingly sacrificing years of comfortable movement for a few hours of immediate but ultimately destructive solace. Now, listen closely. We're going to dive into 9 critical insights today that can transform your relationship with your chair and your body. But I promise you, the 10th and final insight, the one we'll uncover at the very end, is the absolute most crucial piece of the puzzle. It's the often overlooked secret, a little-known element that reveals the true culprit behind your discomfort. And without understanding it, any attempt to regain your freedom of movement will fall short. Stay with me until the end, because missing this final revelation could mean missing out on the joy of a truly active, pain-free life. When you melt into that deep recliner, your body, in its relentless quest for efficiency, essentially declares a holiday for its support crew. Think of your core muscles, that deep encircling band of muscle acting like your body's natural corset, stabilizing your spine. They clock out. Your glutes, those powerful engines in your backside meant to lift you, propel you forward, and keep you balanced, they're fast asleep, practically snoring. Even the intricate network of tiny muscles lining your spine, designed for constant micro-adjustments to keep you upright, hang up a gone fishing sign. This process, where muscles become inactive and lose strength, is called disuse atrophy. Imagine a neglected garden hose, left coiled in the sun, slowly becoming brittle and useless. The moment your furniture takes over the job of these crucial stabilizing muscles, they begin to weaken. A study from the American Physical Therapy Association highlights how prolonged sedentary postures directly contribute to a significant decrease in core muscle endurance, making everyday tasks like standing, bending, or even just turning over in bed surprisingly challenging. When your primary support crew is off-duty, smaller, unprepared muscles, like those in your lower back, are forced to pick up the entire workload. They're not built for that kind of constant heavy strain, and it's no wonder they eventually start screaming in protest. This imbalance doesn't just cause pain, it steals your ability to confidently carry groceries up the stairs without a second thought, or rise from a low couch with ease. Next time you find yourself in that deeply cushioned chair, consciously try to sit up straight, engaging your core. Feel how much effort it takes compared to a firm dining chair. That difference is your body telling you which muscles are currently on permanent vacation. Picture yourself, or a loved one, lost in the embrace of a plush recliner. What shape are you making? Your head often pushes forward, chin nearly resting on your chest, straining your neck as you peer at a screen or a book. Your shoulders round, collapsing inward. Your upper back hunches like a question mark. But the most insidious transformation happens in your lower back. Instead of its natural, gentle inward curve, it's forced outwards, flat, or even rounded. Your entire body folds into a giant, unhealthy letter C. Your spine is a marvel of biomechanical engineering, designed with a series of gentle spring-like S-curves that absorb shock and distribute pressure evenly. This C-shaped posture brutally reverses that natural architecture. It tucks your pelvis under you, a critical foundation shift that's akin to yanking the very base out from under a sturdy building. This sustained position puts relentless low-grade stretching pressure on the resilient ligaments and connective tissues in your back, while simultaneously squashing the front part of your spinal discs. This phenomenon, known as creeping deformation, means that soft tissues gradually lengthen and weaken under prolonged stress, losing their ability to support you. Imagine pinching a soft jelly donut between your fingers for hours on end. All the jelly slowly but surely squishes out the other side. For hours, you're subjecting your delicate spinal discs to that same kind of uneven, deforming pressure. It's not a sudden, dramatic injury. It's a slow, insidious process that relentlessly wears down your body's critical support structures, manifesting as that persistent ache when you try to reach for something on a high shelf, or the difficulty in simply bending over to tie your shoes. Research from the Journal of Orthopedic and Sports Physical Therapy consistently links prolonged lumbar flexion, the C-shape, to accelerated disc degeneration and chronic pain. Try this simple counter. Stand up tall with your back against a wall. Feel how your head, shoulder blades, and backside naturally touch the wall, with a small, gentle space behind your lower back. This is your spine's happy place, its optimal alignment for strength and resilience. The C-shape is its complete opposite, a position your body silently struggles against. Let's dig even deeper into why those crucial muscles go dormant. Your core isn't just about a six-pack. It's a deep, sophisticated, three-dimensional cylinder of muscle that wraps around your entire midsection, from your diaphragm down to your pelvic floor. Its primary, vital job is to create stability before you even initiate a movement. It's the sturdy trunk of the tree that allows all the branches, your arms and legs, to move freely and powerfully without destabilizing the whole structure. In a deep recliner, that entire intricate system is essentially deactivated. The chair does all the stabilizing for you, effectively making your core redundant. So it gets profoundly lazy. It literally forgets how to fire up quickly and automatically when needed. This leads to a condition sometimes jokingly called dead butt syndrome, or more formally, gluteal amnesia, where your brain's connection to your powerful glute muscles becomes sluggish, almost like trying to start an old engine that hasn't run in years. You might even find yourself consciously trying to squeeze your glutes only to feel very little activation. Your glutes, the largest and most powerful muscles in your entire body, are designed to launch you up from a squat, power you up a flight of stairs, and drive you forward with every confident step you take. When they're asleep at the switch, your body, ever resourceful, has to find another way to compensate. It recruits your hamstrings and, you guessed it, your already overstressed lower back muscles to perform tasks they were never designed to do. This compensation is a direct, well-worn path to nagging hamstring strains, persistent knee pain, and that chronic, debilitating ache in your lower back that makes even a short walk feel like a marathon. Studies published by the National Strength and Conditioning Association consistently show that individuals with chronic low back pain often exhibit significantly weaker and less responsive gluteal and core muscles. This isn't just about feeling weak, it's about losing your natural momentum and agility to effortlessly pick up a dropped item or step over an unexpected obstacle. Try this right now. Stand up, place your hands on your backside. Now, squeeze your glute muscles as hard as you can, feeling that powerful contraction. That sensation of strength and activation, that is the engine that is completely turned off and neglected when you spend hours slumped in that C shape. Reconnecting with that power is the first step to reclaiming your natural movement. Let's be brutally honest about what it really takes to get out of that deeply comfortable chair. It's rarely a smooth, graceful movement anymore, is it? It often evolves into a multi-stage project, a minor feat of engineering. First, there's the mental preparation, the silent sigh, the bracing yourself for the impending effort. You know it's going to be a struggle. Then comes the initial lean forward, but you can't quite generate enough leverage, so you have to rock. 1 tentative rock, 2 more assertive rocks, and on the third, with a grunt of exertion, you launch yourself upwards, pushing down on the armrests with all your might. Your arms and shoulders strain, your face might even contort slightly. The chair lets out a creak of protest, a testament to the battle being waged. You, too, often let out that signature grunt, an involuntary sound of effort. And then you're up. But are you really up? Often you're frozen in a half crouch, your hips locked, your back stiff as a board, perhaps even listing slightly to one side. You instinctively reach for your lower back or brace your hands on your thighs for support, like an old sea captain bracing against a sudden squall. You stand there for a good 5, 10, or even 15 seconds, waiting for the body's rusted machinery to slowly, painfully creak back into alignment. It's only after this awkward, painful pause that you can take your first tentative, shuffling step, cautiously assessing your readiness for movement. This entire ritual, this struggle, this visible discomfort is your body screaming a clear message. It's been forced into a fundamentally bad position for far too long. Research from geriatric studies, like those often cited by the National Institute on Aging, directly correlates difficulty rising from a chair with increased risk of falls and reduced overall functional independence in older adults. This isn't just about discomfort, it's about maintaining your ability to live life on your own terms, to walk across a room without fear or hesitation. Try this simple observation. Next time you get out of any chair, notice precisely where you feel the greatest strain. Is it your knees protesting the load? Your back locking up? Your shoulders burning from pushing off the armrests? That tells you which muscles are shirking their duties and which ones are being forced to overcompensate. This awareness is your body's personal roadmap to understanding where the real work needs to begin. Okay, take a deep breath. Here's the really good news. You absolutely do not have to evict your beloved chair. You just need to become a clever strategist and outsmart its inherent design flaws. Our mission is to actively fight that detrimental C-shape by gently but firmly reintroducing the natural, healthy inward curve to your lower back, even while you relax. The simplest, most accessible tool for this transformation is something you already have, a regular bath towel. Grab one and roll it up lengthwise into a tight, firm log. It needs to be dense and resilient, not soft and floppy like a pillow. The ideal thickness is personal, so start with a thinner roll and experiment by adding more layers or using a thicker towel if you need more support. Now, for the crucial step. Before you even think about sinking back into that chair, place your meticulously rolled towel horizontally across the backrest, precisely where your lower back is going to be. You want it to sit right at your belt line, nestled perfectly into the small of your back. As you lean back, it should fit snugly into that natural hollow, filling the gap between you and the chair. This acts as a gentle, unwavering reminder for your spine. It might feel a little unusual, even slightly awkward at first. That's normal. It should feel like a supportive, gentle pressure, not an aggressive poke or a rigid brace. If it feels like it's pushing you too far forward or creating discomfort, your roll is likely too thick. If, on the other hand, you can't feel it at all, it's too thin to be effective. This deceptively simple support works wonders by preventing your pelvis from tucking under and by actively maintaining your spine in a much happier, more neutral alignment, alleviating pressure on your discs. The Mayo Clinic, a leading authority on health, frequently recommends simple lumbar supports for maintaining spinal health during prolonged sitting, confirming the profound impact of this tiny adjustment. This means you can enjoy your favorite show, comfortably reading or chatting, knowing your spine is being cared for, not compromised. Try this at home. Experiment with various sized towels or even a small firm throw pillow until you find the perfect support. Your goal is to discover the specific level of firmness and thickness that makes you feel like you could sit up straight with significantly less conscious effort, almost as if the chair is now helping you rather than hindering you. Even while you're enjoying your chair, you can begin the vital process of gently retraining those dormant muscles, coaxing them back to life. Think of these as tiny, almost invisible exercises you can seamlessly weave into your day, perhaps during commercial breaks or while listening to a podcast. As always, if you have any heart, balance, or joint issues, please talk to a clinician first. And critically, if any movement causes sharp or radiating pain, stop immediately. First, let's send a wake-up call to your glutes, those powerful, often forgotten muscles. Sit comfortably with your back well supported by your new towel roll and your feet flat on the floor. Without shifting your body position at all, simply squeeze your buttock muscles together. Squeeze them with intention, as if you're trying to gently crack a walnut between them. Hold that conscious squeeze for a solid 5 seconds, really feeling the activation. Then slowly and deliberately release. Crucially, don't hold your breath. Keep a steady, natural rhythm. Repeat this 10 times. This focused action is a direct line, re-establishing that vital brain-to-muscle connection that has gone slack. Research from the American Council on Exercise demonstrates the effectiveness of targeted isometric glute contractions for improving muscle activation and reducing low back strain. This simple exercise, done regularly, means you'll eventually find yourself rising from a chair or walking with more power and less effort. Next, let's engage your quadriceps, the big muscles on the front of your thighs, and gently activate your core. Sit tall, maintaining that slight lumbar curve from your towel. Gently brace your stomach muscles, as if anticipating a light touch to your belly button. Not a rigid clench, but a subtle tightening. Now, slowly extend one leg straight out in front of you until it's roughly parallel with the floor. As you do, really squeeze the big muscle on the top of your thigh. Hold it there, feeling the work, for 3 seconds. Then lower it back down with deliberate control. Don't just let it drop. Alternate legs, performing 5 repetitions on each side. Finally, to boost circulation and keep your ankles and calves supple, just draw gentle circles with your feet. Make 5 slow, deliberate circles in one direction, then reverse for 5 in the other. Then actively point your toes away from you as far as they comfortably go, feeling the stretch in your shins, and then pull them back towards your shins, feeling the stretch in your calves. This helps prevent stiffness and promotes healthy blood flow after you've been sitting for a while, making those first steps away from the chair feel far less hesitant. Try this simple trick. Pick just one of these exercises and anchor it to a predictable routine. Perhaps every time the opening credits of your favorite TV show start, that's your cue to do a set of glute squeezes. Or during every commercial break, you do your leg extensions. This mental trigger turns a chore into a habit. Every single time you peel yourself out of that chair is not just an exit. It's a golden, non-negotiable opportunity to actively undo the damage of prolonged sitting. Make this simple stretch your spine's essential reset button, a vital habit that counteracts hours of slumping. Again, if you have any balance or joint issues or any pre-existing spinal conditions, please talk to a clinician first. Stand up with a stable base, your feet about shoulder-width apart, ensuring you feel firmly grounded. Place the palms of your hands gently on your lower back, with your fingers pointing downwards, as if you're about to slide them into your back pockets. Your hands aren't pushing. They're there purely for gentle support and as a proprioceptive reminder, meaning they help you feel what your body is doing. Take a slow, deep breath in, filling your lungs. As you slowly breathe out, gently and mindfully press your hips forward. Allow your shoulders and head to softly tilt back, your gaze rising naturally towards the ceiling. You are deliberately creating a gentle arching back bend, the exact therapeutic opposite of the detrimental C-shaped slump. The goal here is to feel a beautiful, gentle opening across the front of your hips and a mild, comfortable engagement in your back muscles. This stretch should feel wonderfully good, like a sigh of relief for your spine, providing a sense of decompression. It should never be a sharp, pinching, or painful sensation. If it hurts, immediately ease off or stop. Hold this gentle extension for 2 or 3 slow, deep, deliberate breaths, allowing your body to soften into the stretch. Then, with control, return to standing straight and tall. That's it. In just moments, you've actively and powerfully counteracted hours of spinal compression and slumping, promoting better posture and circulation. Research from spinal rehabilitation clinics consistently shows that regular, gentle lumbar extension exercises significantly reduce back pain and improve spinal flexibility. This means you're not just passively accepting stiffness, you're actively fighting for your body's comfort and flexibility. Try this commitment. Make a firm deal with yourself. You are not allowed to take a single step away from the chair, not to the kitchen, not to the bathroom, until this anti-C stretch is completed. By linking the action of standing with the action of stretching, you create an unbreakable beneficial habit. When you venture out into the world, or even just ponder a future furniture purchase, you can now arm yourself with knowledge and become a true posture detective. Here's what discerning eyes look for in a chair that truly supports your body rather than undermining it. First, the crucial sink test. If you sit down and the cushions completely swallow you, engulfing your entire body, consider it a red flag. It's a comfort trap. What you truly want and need is firm, resilient support that holds you up, not a shapeless beanbag that demands a full-body excavation just to get out. You should feel like you're sitting on the chair, firmly supported, rather than being consumed by it. The goal is active sitting, not passive melting. Second, master the 90-90-90 rule for optimal ergonomics. When you're sitting with your backside fully against the backrest, your feet should be flat on the floor, your knees bent at roughly a 90-degree angle, and ideally about level with your hips. Furthermore, your elbows should also form a 90-degree angle when resting on the armrests. If your feet dangle off the floor, the chair is too high, creating pressure under your thighs and pulling your pelvis out of alignment. If your knees are pushed up towards your chest, it's too low, forcing your spine into that dreaded C shape. This alignment ensures proper weight distribution and minimizes strain. Third, meticulously check the seat depth. Scoot all the way back into the chair, ensuring your lower back is supported. Now, try to fit 2 or 3 fingers between the back of your knee and the very front edge of the seat cushion. This small gap is vital. If the cushion presses uncomfortably into the back of your knees, it indicates the seat is too deep. This can restrict healthy circulation to your lower legs and pull awkwardly on your lower back, exacerbating discomfort. Finally, critically assess the backrest itself. Is it merely a big, uniform, puffy pillow that offers no specific structure? Or does it possess a thoughtful anatomical shape with distinct, built-in support for the natural curve of your lower back? A truly back-friendly chair, one that is ergonomically designed, will actively support your spine's natural healthy curves rather than coercing it into an unnatural, unhealthy posture. Research consistently shows that chairs with adjustable lumbar support significantly reduce spinal load and improve comfort for prolonged sitting. This knowledge empowers you to make informed decisions that protect your back, whether you're at home, at a friend's house, or even in a waiting room. Try this simple exercise. Next time you find yourself in a waiting room, a coffee shop, or even someone else's home, consciously test the chair you're in. Does it pass these 4 simple tests? Just by actively noticing and evaluating, you become more profoundly aware of your own body's needs and the subtle, often damaging effects of poor posture. It's absolutely crucial that we get this straight. Your beloved recliner isn't the villain here. It's not an evil entity conspiring against your comfort. It's simply a tool, a piece of furniture. The genuine problem isn't the chair itself. It's the deeply ingrained habit of staying locked in any one static position for an uninterrupted marathon stretch of time. Think of it this way. A car isn't inherently dangerous, but if you were to remain motionless, rigidly fixed in the driver's seat for 8 hours straight, day after day, that static, unmoving posture would profoundly wreck your body too, causing stiffness, aches, and reduced mobility. That wonderfully comfy chair just makes it incredibly, seductively easy to become utterly motionless for 3, 4, or even more hours at a time, completely oblivious to the toll it's taking. The true enemy, the silent saboteur, is being static. It's the lack of movement, the absence of micro-adjustments, the prolonged absence of natural spinal and muscular activity. When you remain static, your circulation slows, muscles starve for oxygen, and your joints stiffen, leading to that profound feeling of being stuck. Studies from the World Health Organization highlight how sedentary lifestyles, defined by prolonged static sitting, are a leading risk factor for numerous chronic conditions, not just back pain. So, the overarching goal here is not to ditch comfort entirely for a monastic life of sitting rigidly on a hard, unforgiving stool. Absolutely not. The true goal is to cultivate mindfulness, to become acutely aware of your body's signals, and to build small, deliberate, positive interruptions into your periods of rest and relaxation. Use that simple towel roll. Make a conscious effort to do a few easy leg extensions during a commercial break. Embrace the power of the anti-C stretch every single time you stand up from your chair. These aren't massive, daunting, life-altering changes that demand Herculean effort. They are tiny, almost imperceptible course corrections, gentle nudges to your body and your habits. But imagine the cumulative effect. Over weeks, over months, and over years, these little, consistent adjustments add up to a profoundly stronger, more flexible, more resilient back, and a body that feels more energetic and free. You hold the incredible power to change this trajectory. It's not about embarking on an impossible quest to find the one mythical, perfect chair. It's about learning to move better and more mindfully in the chair you already cherish and love. This isn't just about reducing pain. It's about reclaiming your zest for life and ensuring you can engage fully in all of the moments that truly matter to you. Try this today. Set a simple, gentle timer on your watch or phone for every 30 minutes. When it discreetly goes off, you don't necessarily have to jump up and leave the chair. Instead, just change your position. Uncross your legs, roll your shoulders back and down, gently twist your torso from side to side, shift your weight. It's a tiny, powerful nudge to break the static cycle, to bring subtle movement back into your body, and to keep your internal engine humming.